Hey everyone, it is Tuesday morning, just about 11 o'clock. I'm here at my mom's house with her dog, so if he barks or does anything silly in the background, I apologize. This video, it's been a few days since what happened, and I'm still really bothered by something, and I find that if I talk it out to someone that kind of has had a similar situation, that I feel better. However, I don't know anybody that's been through this situation, so my second thought was to come on here and talk to you guys and hopefully just feel like I'm being heard, and even if there's no response, that's fine. Sorry, I just woke up. I haven't done my hair or my makeup or anything yet, but I thought it would be a good time because Mom is out of the house bowling, and there shouldn't be many interruptions. It's kind of a sit-down story time type of video. So the new season of Grey's Anatomy is coming up this week. I clicked into Grey's Anatomy the season that they had the hospital shooting. I had gone home one night, turned on the TV after work, and thought, oh, this is a really good movie. Not realizing that it was actually the Grey's Anatomy shooting episode. That is beside the point. That's not what I'm trying to get at, but that's sort of when I started watching Grey's Anatomy and realized that, you know, a lot of their situations were pretty over the top, pretty heavy, very, you know, lovey-dovey type of show. And I fell in love with it. And ever since then, every Thursday, I have watched Grey's Anatomy. Then last year I decided to stop getting cable because I had Netflix, I had, you know, websites that I could go to get shows, everything's streaming nowadays. And I thought, you know what, why am I spending so much money on cable when I'm really only using you know, Netflix and all that kind of stuff. And I have a smart TV, so it goes right on my smart TV. So I missed a bunch of episodes from last year's Grey's, and the new season starts this Thursday. Total plug. And I wanted to kind of refresh and make sure that I had caught up on everything, and that's the dog barking in the background. So when I have a bath at night, especially my mom's big soaker tub, I like to bring either my phone or my tablet and watch some things either on YouTube or Netflix, and I decided to throw on Grey's Anatomy and watch a couple episodes. And there was an episode of a lady who was on her third heart transplant, and she required to be shocked back to life because her heart rhythm was abnormal. In order to be able to shock somebody back to life, they have to have a rhythm. You can't see that straight line that goes beep and try and bring them back. It just doesn't work. And a defibrillator or the ones that we use like in public settings are ones that recognize a rhythm that can be successfully shocked back into normal rhythm. If there is no rhythm, you don't have much of a chance, and CPR, you know, chest compressions are, you know, the way to actually do it. But in this scene, she did have a shockable rhythm, and they went ahead and they put the pads on the body and they shock. So normally, you know, in medical dramas like Grey's or say ER back in the day, or even Scrubs, they would always have paddles, and that doesn't really happen much anymore. There are still paddle kits out there, but what it is now is a big sticker here and on your back, just like almost like where it would be here, it's on the back. And that's attached to a machine, and that's what shocks you. So this was before I was diagnosed with CVID and was having all these really odd, weird symptoms. I had had severe pneumonia that caused me to go into the ICU on nasal intubation, and it came on like that. And then I had pericarditis, which came on like that. And within like 4 or 5 weeks, I was in the hospital with a new issue, not really, knowing what the whole picture was that was going wrong. We all knew that something was going wrong and just couldn't figure what at the time. And the third time that I went to the hospital, it was about 2:30 at night, and I could feel my heart beating out of my chest. It was beating so fast I could look down and actually see my chest quivering. And I couldn't catch my breath. I felt like I was going to faint. I couldn't manage to stand without assistance. It just felt like I wasn't getting enough blood anywhere, and especially my brain. I just felt off and odd. And I called 911. It was the first time having called 911, and they came and they put all the stickers on in the house before, they take you outside. And my heartbeat was at 240, and my blood pressure was quite low. So they took me to the hospital. They cut my clothes off. They hooked me up to everything, all the machines, all the monitors, and my heart was still between 235 and 248, which is just astronomical. I don't know how to even describe. It's like your chest is doing a dance under there, and there's nothing you can do to stop it. You're short of breath. You're having a difficult time explaining your symptoms. And it was scary. And the doctor tried 2 IV medications first. And I remember him saying to me, we're going to give you this medication, but it's not without side effects. And I said, okay, well, what's the side effects? And he said, obviously kidney issues because it's going through your kidneys, liver issues because it's going through your liver. But the worst side effect is the way it makes you feel. And it makes you feel like the world is coming to an end. And I was like, come on, like this is just medication. How is that supposed to make me feel that way? And sure enough, after the second dose of the medication to bring my heart rate down, I honestly felt like the world was ending. There was a internal feeling of, this is it. Everything's for nothing. Everything is ending. I don't know what I'm doing. I don't know what's going on. And they were talking me through it. But I remember crying and saying, like, what's the point? What is going on? I don't understand. And there was 2 people there that I very clearly remember, was a nursing student who held my hand and just kept saying, everything's gonna be okay, everything's gonna be okay. And that was the night that I met a nurse. His name is Ken, and he has been absolutely fantastic. Every time I've gone to the ER and he's there, he comes over and he, talks to me and to say what's going up, and he gets me seen really quick. And, he just kept saying, you're going to be okay, Tamara, you're going to be okay, Tamara. And you just have this inner feeling of dread, it's such an odd thing that a medication can make you feel something emotional as opposed to something physical. The IV medication didn't work. My pulse was getting higher and my blood pressure was getting lower. And they said, I'm sorry, Tamara, but you have to consent to us shocking your heart. And they had to do a procedure called Cardioversion. And that's where you have an unstable rhythm and they shock your heart to try and get it back into a stable rhythm. they're supposed to put you under, but because it was a emergency situation, as they were giving me the propofol, as they were giving me the propofol, they shocked me, and I remember every second of it, and it was like my whole body was lifted off this table, and I remember there being a lot of people, because this doesn't happen very often, and it's a teaching hospital, so there was a lot of people in the room, and I just remember screaming, and at first I didn't even know it was me that was screaming, which it sounds so stupid. So they shocked me once while I was awake. I fell asleep or was put under from the medication, and then they had to shock me a second time. So they gave me the meds and they shocked me, and I only remember a very small portion of that one, but the first one I can still feel like it was like a donkey is kicking you in the chest, like and your whole body comes off the table, like, and you hear people saying like things that you've been trained to do, like, you know, are you clear, are you clear, are you clear, everybody clear, stand back for shock. And it was like, it was so scary, and I wasn't sure if I was gonna make it or not. And watching the show the other night, it just triggered something in me that I've been trying not to talk about too much, or you know, focus on, because it was honestly one of the scariest times in the hospital. They say when you're shocked, regardless of whether it's to bring you back to life or to reset your heart, that you die for up to 20 seconds. And I don't know if that's true. Like, I don't know if I don't know if that happened. I don't know. I just remember the physical feeling of it, like, of it affecting every organ and cell and atom in my body, and it just, I will never ever forget it. And I do have nightmares from that day. And I do take medication to help those nightmares go away. It's called prazosin, and it's been effective 98% of the job. Like, I know that I will have a dream, but I can't remember it when I wake up. But there are some dreams that you just don't forget, and ever since I watched the episode the other day on ER, I've just been dreaming and dreaming and dreaming and dreaming and dreaming about things, and I don't know if that will ever go away, because it's something that I honestly, I don't talk about a whole lot, because it's a scary thing, and people don't understand, and it's hard to, when you're sick, it's hard to have people that are in your life consistently, because you're always having, you know, something going wrong. I mean, I've been lucky in the past year and a half that things have settled down, but there's still a lot of things. But this is one of, you know, the admissions that I don't like to talk about, and that I don't like to look back on, because it was honestly the scariest time, other than when I was diagnosed with lung clots and CVID. It sort of goes like, you know, diagnosed and treated for lung clots, and then it goes to the cardioversion in sort of order of, you know, which one was more difficult, and which one affected my life more, and whatnot. And it definitely is like CVID diagnosis with pulmonary embolism, and then the cardioversion. I just thought I'd come on here, and if anyone else has had a similar experience, please, please, please comment in the bottom below. I know there's a lot of people from groups, online groups, that watch my videos. Yeah, just if you've had a similar experience, I would love for you to share it, whether you do it in the comment section or whether you DM me. And that's all I wanted to come and talk about today, because it's been on my mind, and I'm hoping that now that I've let it out and talked about it, that hopefully it will sort of lessen the impact that it's been, you know, happening over the last little while. So I'm hoping and praying that that's the case, and I just want to thank you guys for watching and all your amazing support that you guys give me all the time. So Bailey says hi. So yeah, so I am just gonna chill and relax and do some deep breathing and exercises and just try and get this off my head. And I mean, obviously I can't move past it because it's been years and it's still bothering me, but maybe talking about it and having it out there will help the flashbacks and, you know, the difficulties that I've been having with it. So thank you for listening, and I will see you guys next time. Bye, guys. Hey everyone, I just wanted to add a quick thank you to all of the healthcare professionals that have helped me over the last 3+ years, and who are still working hard despite the current pandemic. I had to write the names down because there's a lot. I want to thank Nurse Ken from the ER for always getting me in when I've needed to and saving my life so many times. Nurse Chris, who has acted as charge and has always been respectful and honest and, you know, tries really hard to get me seen and out of there as quickly as possible. Nurse Pim, who always gets my blood work, does an amazing job. All the amazing doctors, nurses, you know, secretaries, people who clean and get you, you know, traveled around, the porters. Thank you to everybody from the ER. I also want to thank the nurses that take care of me at the infusion clinic where I get my infusions. Letitia, Rob, Denise, Michelle, who is unfortunately no longer there, and I miss really, really bad because her and I got along really, really well. Nurse Chris from the hematology clinic, she really helped me out last time I was ill and really advocated for me. My pharmacist Aman from IDA, who is just a gem in a world full of coal. He is an amazing person who tries to do everything to make sure that you're taken care of as best you can. Doctors, Dr. Joseph, my cardiologist, Dr. Sear, my immunologist, Dr. Lincolns and her team at the hematology clinic, Dr. Cividino, who does rheumatology, Dr. Hatcher, who is my pain specialist, and definitely not last, he should be first and everything, is Dr. Jason On. Dr. On is spelled A-N. He's the one who was a resident when he found my CVID. He had happened to have read an article about it and thought it fit with my case, and sure enough it did. And I was able to start treatment 3 days afterwards because of him. And he has been an advocate for me since the beginning of this. And even though he has moved away from doing care in Hamilton, he applied for special privilege to continue to be my physician because I'm sure he's probably writing a paper or two, but we get along really well, and there's no other doctor that I think I would trust as much as I trust him. So to everybody, thank you. To all of the blood donors, it takes 10,000 donors for me to get 1 day's worth of treatment. So on the months where I need 2, 3, or 4. That's up to 40,000 people that have to go in and get their blood taken, so that they can separate the plasma and the immunity cells to put into me. And I am so grateful and so amazed that even though we're going through a world pandemic, people are still doing things like donating blood and volunteering and all of those things. So thank you. And it's because of you that I am still around to do vlogs like this. All right, bye guys. Thanks.